What's up YouTube? It's me, Jamie K, and today I wanted to talk about how it's been being a brand new ER nurse. I've always wanted to be an ER nurse ever since I was little. Ever since I made my mind up that I wanted to be a nurse, I automatically thought emergency, emergency, emergency. So I just wanted to tell you guys how it's been. I just got out of orientation last week. I had a 12-week orientation. So I had 3 months of orientation. I also got 2 extra weeks because I felt like I wasn't ready to come out of orientation. I really had a total of 14 weeks orientation. So I got to follow my preceptor around. I learned lots of things really fast, which is what I love about the ER. I love the organized chaos. I love getting new patients and not having the same patients for days. I love the environment. But I just got out by myself last week. So tomorrow will be my 5th shift. Tomorrow will be my 4th shift by myself, alone, as an ER nurse. So I wanted to talk about what I like, what I don't like, how I feel. So I'm gonna start off with if I felt like it was hard, because that was my #1 concern working in the ER. I was throwing myself into one of the hardest specialties in nursing, and I was kind of scared. I was kind of scared to do that, but I also felt like it was necessary because I felt like doing that would make me a better nurse in the end, and might as well start off where you want to end up. So I didn't want to start off in med surg and then go to ER. I just wanted to start off where I wanted to be. So even though I threw myself to the wolves, I'm grateful for doing that as well. While in orientation, I loved my preceptor. She was very helpful, and I always had lots of questions. She was very patient in answering all of my questions. That's what I loved about orientation. Now that I am alone, I do miss my preceptor because she was always there to catch my mistakes. I know everyone makes mistakes, but I just felt a sense of comfort and cushion with her there. But now that I'm on my own, it's forcing me to feel comfortable without the cushion being there, and I feel like that's also making me a better nurse. I do think that the environment is challenging. I don't want to say hard because it's not impossible, but it is overwhelming, especially being a new graduate. And everything's brand new. It's a brand new floor, brand new people, brand new environment. And I think it's kind of overwhelming in the beginning, but I'm going on month 4. I've been a nurse for 3 months, going on 4 months, and it gets better every day. I can say that I do feel more confident every day. I do feel more comfortable every day. That was one of my weaknesses in my orientation, was confidence. My preceptor always told me that I didn't have any confidence and I'm too hard on myself. And I knew that going in, that I didn't have a lot of confidence. And I did notice that I was always hard on myself. If I made a mistake, I would actually cry. I would just feel like I don't belong here. I don't know what I'm doing here. I would go to work saying, I don't know what I'm doing. I would feel like I didn't know what I was doing. I still feel that way. I work tomorrow night and I still am going to go into work feeling like I don't know what I'm doing. But I would get through the shift fine. But it's just like my thoughts and the way I feel and my confidence is something that I'm still working on to this day. My preceptor tells me that it'll get better with experience. So I think that is the best advice for low confidence. I can also say that working in the ER has helped me improve lots of my skills, my bedside skills. So like IVs, I feel like I've gotten good at IVs because I do them on every patient that comes in if they don't already have one. And I just get lots and lots of practice with IVs. I've done lots of Foleys. I feel like my putting in Foley skills, my Foley catheter skills have gotten a lot better. I've gotten a lot faster. I used to take forever, like trying to put the sterile gloves on and stay sterile. That was like half of the procedure right there, is how long it took me to put on my sterile gloves. So I've gotten faster with that. I've gotten better with my communication skills. I feel like in the ER, lots of patients have lots of questions all the time because I always have different types of tests, and sometimes you're not allowed to eat, and sometimes you have to get an IV even if you come in for something that you think is simple. Patients have lots of questions all the time, and I used to be afraid that I wouldn't always have the answer, and I kind of didn't have really good communication skills. But I feel like my communication has gotten better, and lots of my skills have gotten better as well working in the ER. So another thing that I love about the ER, and I'm sure you guys will love about the ER, is teamwork. I feel like every ER has teamwork. Teamwork literally makes the dream work. I don't know where I would be without my team. Everyone is so helpful. I always have lots of questions. And before I do something, if I'm not sure about it, or if I'm uncertain, or if I've never done it before, can you come in with me and help me do this, or can you show me how to do this, or is this the right way? And they're just so helpful. They'll even come in and show me how to do it and then let me do it. And it's just always really good to have people there that have your back, and they're not impatient, and they don't get frustrated if you have too many questions, because they understand that you're new, they understand where you're coming from, they've been in your position before. So I think that teamwork is really great, especially in the ER. If someone has a patient come in and we don't know what's going on with them, their symptoms are kind of, we don't know what's going on with them, lots of people will come in the room and assist you. And I think that it's just great that you're not having to deal with that situation by yourself. Lots of backup I think it's great. So what types of patients will you see in the ER? We get lots of strokes, we get seizures, we get brain bleeds, we get heart attacks, we get strokes, we get strokes, we get strokes, drug overdoses, irregular rhythms, cancer patients, traumas, car accidents, gunshot wounds. I've seen a couple of those recently. Falls, broken bones, hypoglycemia, hyperglycemia, DKA, patients that come in with new onset irregular heart rhythms, and you name it, either we've seen it or we'll see it very soon. So I've been blessed to be able to work with so many different diseases and disorders in such a very small amount of time. That's what I love about the ERs. I get to learn a little bit about everything. So I feel like I've seen so many things, and I've learned so many things in just 3 months. And even being on my own by myself, I feel like I've just seen even more. It kind of can get overwhelming. I know I said I love to get a patient and then get another patient and then get another patient and not have the same patient over and over again. But that's also kind of like a downside, is that you literally don't get a break. Like, that's obviously the point of ER. You get 4 patients, and as soon as you get rid of 3, you get 3 more, like all at one time. And sometimes you get all 4 new patients all at one time. So that's kind of the stressful part, is you're having to prioritize which patient is more important. Do I need to see the patient that's actively having seizures first, or do I need to see the patient that has abdominal pain? Or what about the patient that just got out of a car accident and they have the C-collar on? Like, you have to be able to prioritize which patient is more important, which one you need to see first, second, third, and fourth. And that's kind of where I feel like the stress comes in, is because, yeah, they teach us in nursing school, but it's a whole different ballgame when you're actually right there, standing in front of the 4 rows. You're like, And you just have to critical think, understand which one's more important, see them first, and then put everyone else in order. And it's like, as soon as you get one patient out, you get another one in, because the ER that I work in is pretty busy, which I'm sure lots of ERs are, but you literally don't get a break. Like, lots of times I don't get lunches. You don't get a break. It doesn't stop. And that's kind of a good thing, because it makes the time go by fast, because you're always busy. So that's another thing that I like about it. Another downside is that, I know I said I'm 22, I am young, but the patients think I'm 12. I will walk into a room and I'll say, "Hi, I'm Jamie. I'm gonna be the nurse taking care of you today." And they're like, "Nurse? You're the nurse? Is this the nurse?" And if it's not the patient, it's the family member. And if it's not the family member, it's the patient. I literally look 12 or 13 years old, and they're like, "You look like you're not even old enough to be here." And I'm like, oh my gosh, I get it all the time. And sometimes it's a compliment. I take it as a compliment, because they'll say, "Don't take the wrong way, it's a good thing you look young." But I didn't know that I looked 12 or 13. So I look super young in the patient's eyes and the family member's eyes. And sometimes it's a compliment, but other times I feel like they see me as not experienced enough. They don't trust me because I am so new and because I do look so young. So sometimes I'll go in and I'll try and start an IV, and they'll be like, "Can I get someone that's more experienced?" Or, "I don't want you to do my IV because you don't look experienced." I had someone tell me one time, they pushed the call light, and I went in to see what was wrong. Like, "Hi, how can I help you?" And she was like, "You can't help me, it has to be a nurse." And I was like, I am a nurse. I'm not your nurse, but I'm a nurse. I can help you. And I was just like, oh my gosh. But other than those 3 downfalls, I sometimes feel like I don't know what I'm doing, and then looking super young and people thinking I'm not experienced. And then the turnover rates, it's stressful now, but hopefully with more experience, the more I go to work, the more I see, the more I experience, I'll eventually feel more confident, and and be an even better nurse. The ER is very exciting because you get to see so many things, you get to help so many people. It feels so good to know that your job is dedicated to helping people feel better. And I think that's one of the main reasons why people say that nursing is so rewarding, because it's humbling. Like going to work every day and seeing how sick people can be, and being there when people are diagnosed with a disease for the first time, or seeing how people are sick with no support system, no family, no help. It's a very, very, very humbling experience. Even not just the ER, but working in a hospital or working as a nurse at all, it's very humbling, it's very rewarding, and that's one of the main reasons why nursing is a great, great, great career to have. But it also can be kind of sad. We do see lots of death. I've had 2 patients that have died. Both of the times were very unexpected, and those experiences allowed me to spend time with the family and learn how to communicate with the family after a loved one has passed away, and how to communicate with the doctors when the patient is declining before they pass away, and just listening to the patient and understanding what's going on, listening to the family and their wishes. Also, postmortem care is something that I've been able to do quite a few times working in the ER, whether it was my patient or not. I have gotten lots of experience with postmortem care. So it also can be kind of sad. It balances out. It's good things, it's bad things, it's happy things, it's sad things, it's the emergency room, you'll see anything. So that's what I love about it. So this was just a really quick video to tell you guys, just like a umbrella about how it's been. I wanted to make one as soon as I got out of orientation so I could compare it to maybe 3 months down the road or a month down the road, just to see how much better I feel and how things have changed from now until then. So I just wanted to give you guys a quick update. I want you guys to ask questions, ask lots of questions, because I was once in nursing school wondering, should I do med-surg and should I not do what I really wanted to do, because I was scared. I was scared to be an ER nurse. I was scared because I thought I wouldn't be able to think fast enough on my feet. I was scared because I didn't want to harm people, because I overthink and I'm too nice, and I didn't want to get walked over, and I was just afraid. So it's okay to be afraid. I'm still afraid. I'm afraid to go to work tomorrow night. But that's just because we're brand new nurses and we work in the emergency room. So don't be afraid, and if I can do it, you can do it. I want to be able to help you guys that are thinking about going to the ER or wondering if you should go to the ER. This video is supposed to be a short video, but I hope it was informational. If you have any more questions, please don't hesitate to leave them in the comments below. I want to say thank you guys for watching. I do appreciate your support, and I hope you guys like this video. Please don't forget to like, comment, and subscribe. Toodaloo.